Welcome to Oyster Dental Care and Implant Studio, Shiliguri.
Hello, I'm Dr. Shomadip Roy, and today we are here at Oyster to discuss with you what implant actually is and the implants that we do here in Oyster. So, what implant actually is, when we lose a teeth, we create a free space in our mouth, and that needs to be replaced for proper chewing and to maintain a proper digestion, because tooths are very important for chewing, mastication and mixing of teeth with the saliva, which helps in digestion. In a normal teeth, what we have is a crown, or the part of the tooth that we see, and a root which stays inside the bone and supports the teeth in its keeps the teeth exactly in its position. So when we lose a teeth, what happens is we can replace it in various ways. It can either be a removable denture or a fixed denture or a implant supported denture or prosthesis. So this implant actually replaces the root portion of the teeth. This is basically a screw kind of thing which goes inside the bone and gets fixed with the bone. After that, after a certain period of time, when the integration of the screw along with the bone is done, we place a crown on top of the teeth. So that is what implant is. Here in Oyster, we actually have three kind of implants. One is a normal implant, other is a UV implant, and the topmost variant of implant that we have is a trabecular type of implant.
So let me show you what an implant actually is. This is a normal implant, and when we open it, we will find a screw inside it. So this is an implant. It goes inside the bone and gets fitted and integrated with the bone. Once this gets integrated and fixed with the bone, a tooth which is fabricated in the lab gets fixed over the implant. And there is also another screw which is present inside the tooth, which goes and gets fitted onto the implant. And let us tighten it. So this is how a tooth gets attached with the implant, and the implant gets attached with the bone and helps you to replace your lost tooth. This is a very simple procedure, but if it is delayed, if you have not replaced it within adequate or proper time, then the complication comes, wherein we may have to do certain other surgical procedures like bone graft, etc., which can increase the complexity and cost of the implant. The procedure is very minor. Even we have patients who have reported without taking any main medications after the implants are placed. Let's show you what an UV implant is. This is basically a UV implant. The main advantage of this UV implant is it gets activated when we keep it in this UV cabinet. This implant stays in this UV cabinet for 24 hours, and thus the surface of the implant gets charged, which helps it convert itself into a hydrophilic implant from a hydrophobic implant. The normal implants, the regular implants, are usually a hydrophobic implants, and this, when it gets charged on this cabinet, it becomes a hydrophilic implant, thus helping it to attract more blood and get integrated within the bone very fast. The normal healing period of a regular implant is 60 days. Whereas the UV implants get usually, according to studies, gets healed within 14 days. So now let me show you what an UV implant is when we take it out of this cabinet. We already have placed an implant for 24 hours. So let me take it out and I'll show you what the UV implant actually looks like. This is our cabinet where we activate the implant. Here is an implant which we have activated for you. So this is an activated UV implant. What you see in here is an activated UV implant which was in this box for 24 hours, and now it is almost ready to be placed in the mouth. So that was all about dental implants, specifically UV implants. Thanks for being with Oyster Dental Care.